Here is Mindy Avery's note cards for her speech. Here is her audience, and then of course me as I'm recording.
My name is Mindy Avery, and this is a speech for my Intro to Speech class through Columbia College. The purpose of this speech is to inform an audience of something that is interesting to me and hopefully will be interesting to you too. The topic I've chosen is REM sleep, rapid eye movement. It's something that I can relate to and something that I've seen throughout my life and my family, and I'll get more into that later. REM sleep is one of the 5 phases of sleep. It's the rapid eye movement, and it is characterized by random movement of your eyes and paralysis of your muscles. Muscle paralysis isn't as commonly known as the rapid eye movement part or the random eye movement, but it is a big distinguishing factor of REM sleep. In adults, you spend about 20 to 25% of a normal sleep cycle in the REM phase, but it occurs 4 to 5 times a night, and usually lasting longer each subsequent time. Infants spend about 80% of their time in REM sleep, and there's quite a few theories as to the function of REM sleep, or why we enter REM sleep. According to Medical News Today, one theory is that it's a consolidation or a stabilization of procedural memory, which is the part of your memory that helps you remember to do basic everyday things, like how you remember to brush your teeth or put on your shoes or to, make a piece of toast. Interestingly enough, your procedural memory is something that's not even lost with Alzheimer's or dementia. So there's nothing to prove that theory again, and there's many other ones. One of them is the ontogenic hypothesis, which states that REM sleep is only vital for infants for brain development, and then it's essentially useless in adults, which explains why they spend 80% of their time in REM sleep and not as much as an adult. Again, none of this has been proven. And this just kind of sums up REM sleep for a normal person, but most of us aren't normal. So, like anything else, there is a REM behavioral disorder, also known as RBD, and it was first identified in 1986 by Dr. Schenk of the University of Minnesota and his comrades. And they did many, many sleep studies and were able to pinpoint during REM sleep when the body does not go through that muscle paralysis, and people are actually able to act out their dreams. You see a lot of REM behavioral disorders in infants and animals. You've seen your dog chase the squirrel in his sleep, or babies will twitch and smile and jerk a lot. And that is because most of the time they do have a sort of REM behavioral disorder that is natural for them. However, in adults, this is not natural, and that's where you get your sleepwalkers, sleep talkers, people. There's stories where people will go out and cook food and then go back to bed and don't eat it. And those are all classified under parasomnias. Specifically in the REM behavior disorder, the patient is a threat to themselves or someone else. What causes the disorder is the monoamines. They're neurotransmitters in the brain that are not released, that are not supposed to be released during sleep. However, in the behavior disorders, they are released, and you're still able to act out your dreams. And that is according to Robert Stickgold of Neuroscience of Sleep. REM behavioral disorder is a very controversial issue because there's no definite diagnostic tests that can be done. They can see the disruption of sleep, but there are traumatic instances where a diagnostic would be necessary, and I'll give you a couple of those examples in a minute. But they find that people who experience, it's more common in people who have a degenerative brain disorder like Parkinson's or muscular dystrophy, narcolepsy. It's very common in with narcolepsy, and people who have a history of the disorder end up usually having something like Parkinson's, and they haven't found a correlation to it yet. But according to the National Sleep Foundation, it is more common in men than it is in women. About 90% of all cases studied for men. Some examples of these that I found on a website called Psychology Today, written by David Randall, include what they call parasomnia pseudo-suicides, and those are people who are thought to have committed suicide in their sleep. And this became an issue, I want to say 96, with a man who jumped out a window in his sleep, had no history of depression or suicidal thoughts. And the issue came whenever it came about whenever his wife tried to collect the life insurance. And she couldn't, because life insurances don't cover suicide. So since then they've done a lot of studies and done a lot of research, and they have what's called the parasomnia pseudo-suicide, which can be classified and covered by life insurance, but it's very hard to diagnose because your patient has passed away and there's no way to tell. So, two other stories that I found also at Psychology Today is one is about a man who is 56 and was traveling with his wife and woke up and had his hands around her throat, and his wife had already passed away. He was charged with murder and went through extensive sleep studies because he had no recollection of this whatsoever. Woke up in shock, and they eventually found him not guilty and acquitted him of all charges because due to the sleep studies they did find that there was a disturbance in the REM sleep disorder. However, there was another man, 41 years old in 1997, who stabbed his wife 41 times in his sleep and then held her head underwater, or what he states is in his sleep. Sleep studies were not able to confirm whether or not he had a REM behavioral disorder, although he did have a history of it, and he is still now spending life in prison. So these disorders I find very interesting. Like I said, it's something that I can relate to. I have never killed anybody in my sleep, don't worry. But I do have a history of sleep talking. I can have a full conversation in my sleep, as can two of my children. I have one son who has night terrors. I have, my mom talks in her sleep. I have cousins that walk in their sleep. So it is something that is interesting to me, and I hope it has been interesting to you too. Thank you.